Morning, good afternoon, good evening. I'm Dr. Mark Di Pasquale here from Adjusted Family Chiropractic in South Morang, Melbourne, Australia. And today, have you ever wondered what happens during a chiropractic adjustment? Well, we have this document here from the Foundation for Chiropractic Progress to take us through that, some research, etc., with regards to what if any of your family members ask what happens in the chiropractic adjustment, what to expect, etc., this is probably really good information for them to understand. So we'll go through it now. So first of all, so whether you're in the chiropractic office or whether you come to visit a chiropractor for pain or headaches, healing from a personal injury, or simply engaging in a checkup, a lot of people come in and get their nervous systems assessed, make sure brain function is working well after many different types of things, whether it be sporting injuries, etc. Quite lately, we've been getting quite interesting cases with regards to recovery from concussion, etc. It's very important to make sure we check the brain and nervous system in those situations for recovery for the long term. So what happens physiologically during an adjustment is very specific. A chiropractic adjustment is a safe, controlled force applied to a joint to restore proper function and mobility. To accomplish this goal, there are a wide variety of effective adjusting techniques that doctors of chiropractic, DCs, learn and are proficient with to treat your neuromusculoskeletal system. So neuro meaning nervous system, brain function, musculo meaning muscles and how they respond, skeletal meaning spine, skeleton, structure, etc. So that complete system working together. Techniques include popular hands-on methods, or many utilize special tables and or instruments. DCs will choose a technique based on your individual needs, body type, or potential conditions like osteoporosis. So it will be well suited to your individual situation, comfort, and preferences. Of interest, we do use techniques that are different for babies, so newborns through babies, adolescents, then to young adults and the elderly as well. Definitely assessing is tailored to the specific person, but also the adjusting as well. So very commonly adjustments are issued by hand with a fast, gentle thrust that encompasses a calculated line of drive applied to a specific joint to restore function. Now, specific is the important word there. So the important term here is specific. The adjustments provided by DCs are very precise and intentional to increase the functional capacity for movement and healing in the involved joints. Unlike popping your knuckles to simply make a noise, DCs examine and palpate the spine with their hands to determine the exact joints involved and the potential of the positional X, Y, Z axis of the joint needing specific attention. They are then able to issue a very precise controlled adjustment applied to the particular joints that are involved. It is important to note that although DCs are commonly known for their work with the spine, pelvis, hips, a great number of doctors of chiropractic also address other joints in the body, such as upper and lower extremities and the arms, hands, legs, and feet. And there can also be other joints as well, jaw, cranium, so cranials, etc. So these are very common as well. So what's that sound? Everyone wants to know what the popping sound is that is experienced during some adjustments. Though minds may race to bones cracking and rubbing together, the answer is much softer. Doctors of chiropractic adjust synovial joints. These are freely movable joints created by two bones surrounded by a joint capsule. The capsule is filled with a lubricant called synovial fluid. Synovial fluid also serves as a source of nutrients for the cells that maintain the joint cartilage. Within its contents, synovial fluid also contains dissolved gases of oxygen, nitrogen, and carbon dioxide. When a synovial joint is stretched, it can create pressure within the fluid that results in an exchange of dissolved gases. In some instances, that exchange will create a sound. DCs will often explain to first-time patients, especially children, that they may hear a sound so that the noise isn't alarming. It's important for patients to know that their bones are not making the cracking noise. Synovial joints can actually be found all along the length of the spine, and your DC will refer to them as facet joints. Facet joints contain lots of tiny nerves to detect position, and they are by far the most common joint type adjusted in the chiropractic office. The formal term for the popping noise is joint cavitation, which is the audible exchange of gases within the joint. It is important to note that the amount of cavitation does not determine the success of an adjustment. Though joint noise does often occur, different types of adjustments will have different levels of cavitation. Even similar adjustments on different occasions may not exhibit the same sounds. Many low-impact adjustments will not have any noise at all, but they are as equally as effective to restore joint function. A synovial joint provides the ability for movement, but it also limits movement to prevent injury. Though it isn't difficult to pop a knuckle to simply make a noise, it is possible to actually overstretch the capsule or move joints of the spine in the wrong direction and cause harm or injury. This is why you should never try to adjust yourself or allow someone else to try if they are not professionally educated. It is pertinent that only trained specialists should issue a chiropractic adjustment to your spine or extremities. Specific adjustments go way beyond a sound show and provide multiple physiological benefits in the process, such as the restoration of normal range of motion as the locked facet joint is freed from restriction, the normalization of nerve function or even vascular function for those structures that might be directly affected, the relaxation of muscles adjacent to the joint as they are able to stop protecting the joint through spasm and resume their normal tonicity, a decrease in inflammation when the stress on the joint is resolved, and a decrease in pain through the release of endorphins at the region of care. These aspects of chiropractic care can help reduce the need for patients to take other medications, such as muscle relaxers, anti-inflammatory drugs, or painkillers. What happens during a chiropractic adjustment is multifold and complex. It holds the advantage of safely restoring properly functioning joints and also aids in providing relief from many symptoms associated with it naturally. So here we have a diagram of the facet joints, which are at the rear end of the spine or posterior. These bones here are the ones you can feel on your spine. If you run your hand up the back of your spine, you're actually feeling these here, and the vertebra and the discs are deeper. So this is an example of a joint capsule and just the joint cavity there. Here are the references for further reading if you do choose. And hopefully you found that information interesting for you and for those around you. If you have any questions with regards to any further about what happens during a chiropractic adjustment, please let us know and we'll try and answer those. If there is any other topics which you would like us to cover too, please do send us an email or just drop us a text or call. Bye for now and have a healthier day.